Mr. President, Director General, distinguished delegates and colleagues, as leaders and decision makers and gatekeepers and advocates of your nation's health, you are constantly faced, on the one hand, by the tensions of dealing with today's immediate problems, and on the other hand, with the challenges of securing a healthier future for your people. You are conscious and committed to applying the best ideas, the best thinking, the best available evidence in your policies and plans. But complexity and uncertainty are attributes of today's realities. And there is also this numbness felt when dealing with a crisis, making difficult decisions. You are eager to know not only what, but also how to. You are eager to go beyond the theory to actionable recommendations. You are eager to work and explore how to engage other sectors and partners and have a better understanding of what we mean by shared governance. You are eager to invest in interventions that work and which yield maximum impact. You are eager to promote integrated approaches and promote health high on the social and health agendas of health high on the political and social agendas of your government. You wish to be better prepared for what is to come. The consultation process, as our regional director just said, was multifaceted, extremely extensive, and extremely rewarding. It is not just giving one-way comments to a series of documents. It was much more than that. In all these meetings, the high-level fora, other meetings, it was an opportunity to debate and share an understanding about a wealth of new concepts which very often challenges our thinking and how to interpret them into practice. I think the idea that this policy was not just to be evidence but also experience-informed has worked nicely. Various issues generated a lot of debate. There was a lot of debate about equity and inequalities, about personal responsibility, about the idea of what is the core business of a Minister of Health, the idea of supportive environments, well-being, and so on. All these are concepts that has given us the possibility to make the space and understand how to integrate them into our new policies. We made sure that Health 2020 was fitting the global reform process and was also sensitive to the fact that you are all in different starting points. A policy fitting its times. It was not to be a document in a vacuum. And above all, the Health 2020 vision to be a doable vision, something that you can take back home and something that can help you and inspire you in your own efforts. So the emphasis in 2020 was on key principles, on values and approaches that could make all the difference, on what works, and what capacity one needs to make it happen. There are two documents, and sometimes there has been debate about the length of the longer document, but it is not an encyclopedia. And I would like to underline the fact that that longer, the Health 2020 policy and strategy, is the document that it's not just that it brings together the evidence, but it interconnects the evidence. How many times at our desks in ministries we embark on writing a policy and not knowing where are the links, where are the connections, how one thinks lead to something else. The idea of integrated policy is in fact the idea of understanding the whole, and this whole is there, embedded in this new policy. Then it is the link between the determinants and the wealth of evidence that we heard today and the need to rethink governance for health to make it happen. It's a framework that it's also for a wider range of partners. We heard clearly and loudly from NGOs, from mayors, from regional governors, that this was a helpful framework for everybody. It was above all a reference to coherence and a reference to legitimacy for change and innovation. I would like to give you two short examples. Take the NCD. The NCD is the big challenge in this region, in the whole world. How can Health 2020 help you or add value in your efforts? I could give you a few reasons. One, it definitely brings a good understanding of the determinants of behaviors or of factors that underline the whole range of the causes of chronic diseases. Second, it's about the capacity to work with others, finance, education, employment, trade, agriculture. That's a context within which an NCD strategy can be successful. And then it's about monitoring and evaluation, and of course about a health system that is committed to universal coverage and to evidence-based prevention and best buys. The other short example I want to give you is a reality. We heard from Roberto Bertolini earlier how long it has taken, repeating very often the same terms, commitment to partnership, to leadership, and how long it takes to make a change. I will give you the example of the FCTC. The Framework Convention for Tobacco Control is probably one of the strongest public health instruments today in the world. And yet, how many times we fail to implement it? Why? Because it needs the appropriate legislation, it needs the capacity, the institutions, the accountability, a host of mechanisms that will make it happen in the countries. These are the preconditions of success. And this is what we try to do with Health 2020, not just drop new terms like whole of society and whole of government and a host of other terms and just leave you struggle with them. We try with you to see how they can become the new context for health and for your strive for well-being in your countries. So this is what we see as the big added value in Health 2020. So lastly, I would like to elaborate to what Susanna was saying earlier, that we are putting into place mechanisms to develop further capacity and guidance to support the implementation, developing core packages in different areas, including, and I just realized that I have not used my PowerPoint, and including, so that's good. But can I just show the last slide, please?
We made believe.
Excellent. So the one after that. That's it. So one of the instruments that we feel could be quite helpful in the implementation, not only of Health 2020, but in this modern world of all the policies and packages that we have for you, is to really be one step ahead with the tremendous potential of communication technology. So we are developing a website where you can navigate easily all these documents, find your way depending on what is your specific interest, but also in the works. We are preparing documents that will make it easy for you to access our websites and use this information. My last word is about the resolution. The resolution refers to adopting the shorter document and welcoming the longer document. It is a compromise after long discussions we have had, and I think that you will recognize that these two come together and that your support welcoming the longer document will give it even more value and status in your efforts. So thank you very much, and I do hope for your strong support to the Health 2020. Thank you.